Did you know that fewer than 200,000 people in the United States struggle with the rarity of a congenital heart defect each year and can last for years or be lifelong? Congestive heart failure, or also known as CHF, is a condition where the heart muscle is weakened and cannot pump blood efficiently, leading to fluid buildup in the body and lungs. It's a chronic, progressive condition that can lead to various complications if not managed properly. Two main types are systolic and diastolic heart failure. Systolic heart failure occurs when the heart muscle is weak and can't pump effectively, while diastolic heart failure occurs when the heart can't fully react and fill with blood. Congenital heart defects have fascinated doctors and scholarly researchers. Did you know that fewer than 200,000 people in the United States struggle with the rarity of a congenital heart defect each year and can last for years or be lifelong? Congestive heart failure, which is also known as CHF, is a condition where the heart muscle is weakened and cannot pump blood efficiently, leading to fluid buildup in the body and lungs. It's a chronic, progressive condition that can lead to various complications if not managed properly. Two main types are systolic and diastolic heart failure. Systolic heart failure occurs when the heart muscle is weak and can't pump effectively, while diastolic heart failure occurs when the heart can't fully react and fill with blood. Congenital heart defects have fascinated doctors and scholarly researchers for the last 3 decades, and while they remain not completely treatable, research offers insight into who is susceptible to heart disease and if they are curable as time goes on. We need to bring awareness to heart disease and understand how many people struggle with this topic and how they can be life-altering. I have 2 congenital heart defects and have researched this topic since I was diagnosed in the fall of 2023. One of the most important aspects of congenital heart defect is to realize and understand how common they are and how people struggle with this. CHD is the most common type of birth defect and is present at birth. It occurs when the heart or blood vessels do not develop properly during fetal development. Approximately 1 in 100 babies in the United States are born with a CHD. The most common type of CHD is a VSD, which is a hole in the wall between the lower chambers of the heart. CHDs are birth defects that affect the structure of a baby's heart and how it works. CHDs can range from mild, like a small hole in the heart, to severe, like missing or poorly formed parts of the heart. Many CHDs can be treated, and some can even be corrected through surgery or other procedures. A hole between 2 chambers of the heart is an example of a very common type of congenital heart defect. As Amy Sanderson states in her 2022 article called Congenital Heart Defects, congenital heart disease is a common birth defect, affecting approximately 1% of live births globally. This translates to about 40,000 babies born with CHDs each year in the United States. The prevalence of CHDs is higher than that of any other condition with more public awareness, such as cystic fibrosis or autism. About 1 in 4 babies with a heart defect have a critical CHD that requires surgery or other procedures in their first year of life. The prevalence of CHDs varies depending on factors such as geographic location, socioeconomic status, and family history. In some regions, the prevalence may be higher or lower than the global average. Some cases of CHDs can be mild to severe, but all forms have some form of the same side effect. Side effects of CHDs include blue skin or lips, which indicates low oxygen levels in the blood. The main side effect of a CHD can vary depending on specific type and severity, but generally include chest pain, shortness of breath, fatigue, and in severe cases, heart attack or heart failure. As Carlos Porter states in his 2023 article, What Are Congenital Heart Defects? Endocarditis, arrhythmia, heart failure, and liver disease are prevalent with this disease. Individuals may feel unusually tired or weak, even with minimal exertion. Babies and children with CHDs may experience rapid breathing or shortness of breath, especially during feeding or activity. CHDs can disrupt the heart's electrical system, causing irregular heart rhythms. There are several side effects of CHDs, but are all very significant and should have awareness brought to these side effects. CHDs have side effects, but doctors and researchers continuously work on ways to treat and manage this disease. There are several ways to try and manage this disease. Doctors diagnose and manage CHDs through a combination of risk assessment, diagnostic testing, lifestyle changes, modifications, medicines, and, in some cases, surgical or interventional processes. As Rachel Kinzer states in her 2021 article, Congenital Heart Disease in Adults, doctors evaluate a patient's individual risk factors, including medical and family history, high cholesterol, and high blood pressure. Researchers are investigating the impact of various risk factors, including smoking, high blood pressure, high cholesterol, and psychological factors like stress and depression. As Andrew Vivek states in his 2024 article, Funding CHD Research to Help Lives, research explores genetic factors that may increase an individual's risk of developing a CHD. Doctors work as fast as possible to develop research and information, but lack of proper money plays a large factor in this. As we conclude, it is important to bring awareness to listeners who are unfamiliar with the side effects of congenital heart disease. CHDs are very rare and can come in many different forms, and some are mild and don't require treatment, while others require multiple procedures. There are several side effects of CHDs, but are all very significant and should have awareness brought to it. Doctors and researchers continuously work on treatments for CHDs. From this speech, I hope you have gained a better understanding about how life-threatening CHDs truly are. Remember, don't take life for granted. Appreciate what this life God has given us. Thank you.